Okay, folks, I think we're going to go ahead and get started, and hopefully some others will join us. But if you haven't already, please do introduce yourself in the chat. And we are going to jump right in. For the sake of time, we only have an hour together today, and I want to make sure we get to all this important information. So welcome again. My name is Erin Bader. I am the Director of Knowledge and Dissemination with the National Center for Adoption Competent Mental Health Services. And I have my colleague and National Center partner, Pat Hunt, today with us today, I should say. And she is the Executive Director of hopefully I get this right, Pat, the Family Run Executive Leadership Association. Usually I like transpose the words.
It's absolutely close enough, otherwise known as Fredla.
Yes,
It's so much easier to just say that. So
So
thank you for inviting me.
yes, so you will learn a lot, I'm sure, from Pat today about engaging families in both child welfare and mental health services. So with that, I will hand it off, Pat.
Well, thank you so much. And most of all, thank all of you for taking time this afternoon to join us for a conversation. I hope that this will be as much conversation as presentation. So hopefully you will get what you came for. You can move the slides. Thank you. I appreciate your help, Erin, today. We're really going to talk about the results of over 30 years of research, learning about various functions that families can serve in state and local agencies and throughout your systems, and know a few strategies for engaging families in their child's care, agency decisions, and policy recommendations. And we talk about engaging families like that's such an easy thing to do. So maybe if you could go to the next slide, I kind of wonder from you, if you're willing to put in the chat box, what one of the biggest challenges you've had in engaging families? What's sort of maybe gotten in the way of doing as much of that as you'd like to? It is hard work. So I'm going to tell you something maybe nobody has told you before. It's the hardest work you're ever going to do. So for people who just put those words out like they're easy, they're not. And I recognize that. So I see people are putting a few things in the chat box. Lack of orientation, big. Trust. Families have a lot going on, and you have a lot going on, and always your schedules don't mesh so well. Hysteria about the system. Legal obstruction. That's interesting. I wonder if I could hear more about legal obstruction, if you're willing to share that. And it's okay to come off mute and share that if you're willing. The systems families have to navigate. It's true. Sometimes there are legalities that get in the way of engaging families to the level that we'd like to. So thank you. Thank you for being willing to open up and share what some of the challenges have been. It's important for us to think about how engaging families is not only everybody's business. Yes, lawyers advising against engaging. Thank you, Jeff. I appreciate that. And as always, we do want to listen to the people that we go to for advice. So, how can you engage other families to inform your work that may not be in the same circumstance as the families that you want to engage at the moment? And hopefully time changes some of that. So as families move forward and make progress, maybe there are ways to engage them. So when I say it's everyone's business, it's because I want you to understand that there's truly a return on investment by engaging families. So engaging families actually yields positive outcomes in every aspect of care, whether it's with the child, the youth, the family, circumstance, the agency or facility. Managed care companies, I put them in there because lots and lots of states are doing managed care in lots of ways right now. in the community and in the system themselves. You can see this little diagram was developed with colors sort of bleeding one to the other. And we're seeing that what changes for children and youth impacts families, impacts what's going on between them and the agencies that serve them, has positive outcomes for managed care, which bleeds over to communities and systems. And we then hope when we get up to that nice purple box of systems, systems then use what they've learned and use those positive outcomes to then make decisions about what else is available for children and youth. So it's really about a circular process. We're going to talk about it probably in a more linear way today as we look at each of these areas and think about what are some of the outcomes that you would like to improve. So think about that for a minute because we're going to give you a chance to put that in the chat box in a few minutes. Next slide, please. So who else says that engaging families is important? This was done in 2022 as a result of combing through over 30 years worth of research. At that point, over 65 researchers had really cited some great examples of why it's important and the benefits that happen as a result of engaging families. What's interesting in the last 2 years, I've come across lots of newer research and new people who do research, people I did not know, who say, oh, we just did this and you should put that in there. And I'm going like, yes, and I will. And when I have time, and can you help me with that? So we're hoping to get this updated soon because I think there are probably more outcomes we could share, but I suspect there will be enough to keep you interested today. Next slide, please. And you can open that all the way across. So I don't know if people can read that at all. It looks pretty tiny to me. Is there a way to make that any bigger, Erin? Maybe
Let
not.
me see. Yeah, let's see.
Oh, now it's off the screen though, isn't it?
Well, that's okay. We can scroll back and forth across that. Can we start
There,
on
is
the
that
right-hand
better?
side? Yep, let's start on the right-hand side of it, though. Can we
Okay.
do that?
Yep.
All right. And then we may have to scroll down. But for children and youth, there is over 30 years worth of research showing that they get earlier access to care, that they have better outcomes around adjustment, functioning, faster recovery process, reduced rate of relapse, recidivism, and deeper engagement with child welfare and juvenile justice. What an outcome that is. And as you look down at the other types of bullets, which are also in italics, those relate to fathers. So by engaging fathers in what's going on with their children, they have better outcomes in school. That's a really important one, especially for child welfare. As we know, graduation rates are not what they could be. Better overall social emotional well-being, reduced likelihood of maltreatment, and I love the less likely for teen pregnancy, and less likely for incarceration, reduced infant mortality. We also know, I think if we keep scrolling down, although I don't know if we can, we know that when dads are living with their children, that there's less dealing of drugs and access to guns. So now these are really important, I think, outcomes across any system. So I know we're talking about child welfare and mental health today, but these are really important outcomes across any system. The family outcomes are pretty powerful, increasing the ability to navigate confusing systems and services, reduce parenting stress. I presume you're going to have copies of this. Am I right, Erin? Will they get
Yes.
copies? Okay, so that you can look at these and really be thinking about these. and reduce sibling discord. Very important to have a stable living situation. We know that many times that's not the case for young people and their families, or that young people may be couch surfing and not be with their families. And so how do we engage families better in their care and engage young people in the decisions about their care as well? So for agencies and facilities, you're going to have earlier access to services as well, and you'll see that some of these cross from one box to another. So if great things are happening for agencies, we know great things are going to happen for managed care. So don't think these are finite boxes in which these outcomes fit. I would like to point out the fourth bullet under agency or facility. I think in this time when workforce issues are so cumbersome, the increased satisfaction of staff in their careers is really an important outcome to think about. And how do we use that? How do we use that to keep staff? We talk about workforce development a lot. I don't think we talk enough about workforce retention and what are the strategies we can use to keep the wonderful people we have who are doing this phenomenal work for children, youth, and families. And what can you do in your agency if you have better data? If you have the quantity and the quality is better, what kinds of outcomes can you get from that? How can you benefit from improved client satisfaction? What does that mean for your contracts? What does that mean from the word of mouth referrals that go out there from one family to another? And how about more successful involvement in care? So really thinking about how your agency can engage families and get these kinds of outcomes. And in another slide, we're going to show you some examples of the functions that families can serve in your agencies that can help make this kind of difference as well. So in managed care, some of that increased enrollment, coordination and care could fit in other boxes as well. Provides for reinvestment. So money that's not used in other ways, being able to save. I think being able to better use resources and be a better steward of resources can produce a return on investment. And that provides for reinvestment. Many managed care contracts also call for you to reinvest, for companies to reinvest in the communities that they serve. So, and always yielding better clinical outcomes. We don't want people to think that family roles take over the clinical roles. They don't. They're there to complement and support the best clinical outcomes possible. So we value clinical roles. In the community, really thinking about improving community tenure. How can we keep children in the community versus being placed elsewhere? Reduces the disconnection from cultures. Increases the community awareness of children's mental health issues so they can design programs that are more responsive, more inclusive, that don't shut children out early on. Many times some of the social activities that are available to children are not as available to children that we're talking about today. And it improves the ability to respond to the community needs. So mental health and child welfare's ability to respond to community needs by strengthening supports in those communities. And the last category, I think, is the system category. So how we make more effective and efficient use of state and federal resources, reducing the out of home and sometimes out of state placements for children. You know, that kind of intervention takes away a whole culture of a child. So really making sure that we use the best resources possible to keep people close to home. Shorter lengths of stay, out of home care, and really improving data for decision making, which is what systems are all about, right? what do we have? What do we need? How do we develop it? How do we pay for it? What are we going to get from it? So thank you, Sharon, for checking in. And we can go to the next slide, which you may need to then, oh, we can make that as big as well. Thank you.
Sure.
So I'd like to take a minute and see, were there any of those outcomes that surprised you? Were you surprised by any of those outcomes? If so, can you put it in the chat box or just like shout out to us?
I wonder if I should go back so they can reference it. Maybe I moved on too quickly here.
Oh, you did fine. You did fine. Less drugs. Yeah, less drugs and guns. That's a little surprising.
I think that like the points that you shared about oh, sorry, I was trying to get the fatherhood ones to show up again. But the points that you shared, now I'm messing it up.
That's okay. Go ahead.
The points that you shared about fatherhood, it's, you know, spending my career in child welfare. I know that it's important to engage fathers, but like really being able to see it in concrete ways of how it leads to better outcomes. And for how, you know, for so long, fathers were overlooked.
Exactly. Exactly. Well, our project, Erin, is has a fatherhood specialist involved now, so we'll be available to do lots of work around engaging fathers and how to do that really well. Did we have any others in the chat?
Let me see. Oh yeah, and some Sean said, love seeing the impact of fatherhood specifically. And then I had a child without active family engagement and they faced teen pregnancy. I can see that connection.
Well, thank you.
Yeah.
So maybe we can make this one a little bigger as well. We have over 50 ways to engage families throughout your system, throughout your agency, throughout your work. And so obviously participating on those planning teams and treatment teams is important. But for families to play a role in establishing connection to community resources. So when I say engaging families, this may not be under this category, may not be the families that you're working with, but it may be other families, families who provide peer support, for example, or families who can be hired in your agency to fill some of these other roles. They can link youth and families to skill and resiliency building activities. Fredla did a PCORI funded project to find out what outcomes were meaningful to youth and to families who received mental health treatment. And it was interesting that the biggest response we got from both categories of people had to do with communication, had to do with keeping their relationships, had to do with being able to have a conversation with one another without it turning into a disagreement or a fight, or how to disagree civilly, right? And so so it was very interesting to look at the outcomes from that project. And so those kinds of skills, those life skills, are really important as we think about youth and families. Under the family, you know, helping families understand insurance and waiver applications and skills development and those kinds of supports, where to find the educational and social supports, that navigation, to help other families understand about your systems, about child welfare systems, education, court processes, taking that stress off the families who are needing services today, and doing leadership training. Really, thank you, Millie, for putting that in the chat. You'll see some great information in there. Millie's also a Fredla staff person. Thank you, Millie, for joining us today. Just going to shout out to Millie. For your agency, we have lots of things that we can, families can do. They can be your greeters. They can perform all sorts of things. They can be partners in a care coordination. In a dyad model, we talked earlier about not doing the clinical work, but being good partners in that work and gathering service satisfaction. Ambulatory follow-up, really important. Who better than a family member can have a conversation with a family after a child's been released from the hospital or gone home from residential care or returned from foster care? Who better than another family member to do that kind of follow-up phone call? Particularly, and even in planning for discharge. If you think about discharge that's happening at a hospital on Friday afternoon, we all know that's like what happens, on Friday afternoon at 3:30, and they have they've been taken off all their medication they were taking before, and now they're on new medication, and so they go home with all these scripts, and the family gets to the pharmacy to learn what? That half of those medications require prior authorization. And now we're back at a whole weekend or 4 or 5 days waiting for medication. And where do we think that child could end up before the weekend's over? Right? So really having other families who have been through it to be part of that conversation while they're planning for discharge, to have that conversation with families to prepare them for discharge planning. So lots and lots of things. And supporting agency readiness to engage families. Serving on governance bodies. You guys already know all those things. In managed care, informing medical necessity criteria, making sure that necessity criteria is written in a way that families can actually access what they need. Doing those similar tasks, as we've talked about in 2 other areas as well. Training MCO staff to effectively engage families and help them stay engaged. What does it take to help families stay engaged? Engaging families is one piece. How are we going to keep them engaged, right? How do we sustain that? We're going to talk about that in a minute too. And then you see some bullets under the community. Resource development. Welcome back. How about welcome back to the community? Really powerful if you think about being taken away sometimes for even 2 years or more from your family, from your culture, right? What does that require? It's sort of like stepping into foreign territory when you're simply coming home to your community, coming home to your culture. So how do we do that in a way that's healthy and in a way that doesn't make children and youth feel like outsiders when they come home, right? So, and families as researchers. Systems, I think pretty much the same thing we talked about earlier, except these are really concrete examples of families can host public policy events. They can host all sorts of events to get information. They can host focus groups. They can work with other organizations to do that as well and develop families events. Families should be consultants to the system. Families should be trainers and co-trainers throughout this system. So we've given you some ideas here. Next slide. So we're going to give you a few strategies in some of these areas, but first I'd like to ask you what kind of strategies you have used, if you can put them in the chat box, for engaging families in care, in agencies, or in policy and funding decisions. What kind of strategies have you used? How have you done outreach? Where do you go? How do you find these families? Erin, you can let me know if there's anyone in the
I
chat
will.
box. Not yet? Maybe you're joining today because you haven't been able to find these families. I saw a couple of you, I know you have.
Yeah. All through Fredla. Well played.
I did not plant that
Yeah.
response.
It was years
Good.
ago, Pat, but we went to kind of festivals that were happening within the communities
Good.
to talk with families. Partner with a local
Yeah.
nonprofit that offers services to families.
Partner
And
with
then-
local centers to help engage.
Yeah.
Yeah, good. Good examples. So families are coming to you. How do you make them feel welcome?
Mm.
Right, we can go to the next slide. Thank you.
Mm.
So we think about a welcoming environment. We think about meeting families where they are. Thank you, Jeff. Good one. Family engagement meetings through the agency. So some of the strategies to engage families receiving services really start when you begin to acknowledge and respond to what they say and need, right? And so that's about developing a relationship. Relationships, I have to say, we spend a lot of money on a lot of things, but when we have relationships, we can get farther. So they're really the cornerstone. Trust is the cornerstone, and relationships are built on trust. So really, trust is the cornerstone of these relationships. And we all know that families may have had negative experiences. And I don't want to say with systems, maybe with people who were in systems or who represented a system or an individual with an agency. And we have to really support families to know that none of us are all the same as everyone else, right? And so sometimes we have to help families move past what their previous experience has been. And so we all come with our own bias. We all come with our own life experiences. And so often families may be hesitant because they've had a life experience that has told them they can't trust. So we provide information to families to help them be really engaged in shared decision-making at this level, at this in-care level, because then they're empowered. They have good information. They have what they need to make an informed decision. And to understand possible barriers to engaging and then develop solutions. Right? To think about what those barriers could be ahead of time so that you can sort of mitigate them beforehand, and to work collaboratively to define those expectations. What are the expectations around families being involved in, let's just say, treatment or care? What are those expectations? Do we have an expectation that they will have some say? Do we have an expectation they'll be an active participant? Do we have an expectation that of ourselves, that we will keep them continuously informed, particularly if a child is out of home or in a residential circumstance? Do we have an expectation that if that's where we work, that we would keep families up to date on what's going on? So some of the strategies really about acknowledging and responding to what they say they need, because with that builds trust. And it doesn't mean you always have to agree. Right? I think this is what you need doesn't work very well. It's like, I hear you, and what about? Right? That's a whole different approach. So next slide. Thank you, Erin. You're phenomenal today. Family who are agency staff, you can open that right up. if I'm the staff of an agency, I should be invited to help develop those policies, practices, workflows, and tools that work for families. Because when I am employed by an agency, I'm coming from a different lens as a family, right? You have, your agency has a culture of its own, and it has all the rules and regulations and norms and who does what. But I also have a lens that may improve that for the families who are coming through your agency door. And so really making sure the job descriptions and policies support authentic family engagement. We can provide training to support family staff to achieve the program goals. Caregiver advisors for document review. Perfect, Susan. Exactly. Great example. Supervisors. Can you imagine being a supervisor and your agency just hired a family staff, and how do you supervise them, right? How does that work? So they need the knowledge and skills ahead of time for
Mhm.
effectively working with family staff. So it's not just a big surprise at the last minute. And the supervisor should be someone within a respected position of influence, because that's the only way the family voice can be carried to that level, right? Next one, please. I'm trying to leave time for questions. So in the management arena, really providing training, mentoring, and coaching. I know at Fredla we do a lot of that. Millie, not calling you out, but you do a lot of that. We have engaging families as trainers and co-trainers in your agency is really important. Support families to translate those agency materials and trainings to include family examples. And I think we just had a nice example in the chat box as well. And ensure that families understand the process, the scope of their role. It's a real setup when we don't understand the scope and authority of our role. If we misunderstand that, it's a setup for failure and probably will throw the whole team off balance a bit. And provide information about fair hiring practices. Families, I think families who get employed by agencies, it's really important for agencies to have clear expectations of their roles, and to also understand that being a family or caregiver, parent, whatever term you want to use, is a day-by-day event like it is for all of us, right? It is for all of us. And so there may be times when I need something that none of my other colleagues need that day, but I do, right? And there may be days that they need something that I don't need. And so to think about how to really best support families in this job ahead of time, because that's about agency readiness to employ families, particularly. Next slide.
Oops.
It's okay. That's okay. Systems. Systems often rely on the people they know. And so it's kind of unfortunate when they don't learn about new people, okay? And so sometimes we'll see where perhaps a state system has the same 3 parents on every committee, making every decision about, policies and funding and things like that. And we may need those 3 people, but they may have more seasoned wisdom now about the history and the past and the things that have changed, that have moved in a right direction, but they may not have the current experience of raising a child who if I'm making a decision about a crisis system or a crisis response service, I probably can be more helpful if I've needed crisis response within the last 2 or 3 years, right? I can make better recommendations because I know it really worked well, and I want it to work like that for all families, and I know what it took. Or there were a couple of things missing that I really wish we'd had. And so I think that's why it's important to think about that combination of seasoned wisdom and current experience. And sometimes current experience is raw,
Mhm.
and sometimes it's emotional. And so we have an obligation to have both, because people with seasoned wisdom can help the people who are still there in the moment be better able, or they can help translate,
Mm.
right, that experience. So know in advance how you're going to provide both tangible and logistical support. Don't wait until you already have families who have been recruited, right? Talk to them about how you're going to support their participation. What's it going to take for them to participate? Are the meetings in person? Do they need mileage? Do they need some sort of stipend or childcare or whatever it may take for them? Have you actually written that into your group or council or wherever you're going to have these families serving? Is that really written into that? Because if the language isn't there about how you're going to support them, that's up to the goodwill of people,
Mm.
right? So I may be a really family-friendly person today, and I may say, we have this money over here and we're going to help families. But then when the budget gets cut, maybe somebody else has my job and I'm not dedicated quite as much. I'm thinking about those dollars even more. And so we could lose it. We could lose the kind of support that actually keeps families coming. And how do we engage family-run organizations? And I can't say this loud enough, long enough, or times enough, because family-run organizations already have the access to a group of families who are quite likely prepared to do this work with systems, with agencies. All right. And so establishing a partnership, a relationship with a family-run organization is really important. And if you live in a state when you don't know where there's a family-run organization, pop that in the chat box right now. And we'll make sure that you get a list of family-run organizations in your state that you can reach out to. And develop a peer recruitment and onboarding plan. If you don't have a peer as part of the recruitment, your success might be a little less likely. So while I'm really excited that that no longer has a family-run org, or we can connect you with families if you need it. We may have families from your state that you could be connected with. That is unfortunate. Thank you for sharing that. So I think, while it might be great to have a state employee reach out to me and try to recruit me for something, if they say, I'd like to schedule a call with so-and-so who's a parent on our group and you, because we'd really like you to join our group, then, that already says we value families and sets the stage for a different type of conversation, I would say, not relationship, but conversation. So the conversation would be, I would be more comfortable in it. I would know then I have a family member I could reach out to sort of behind the scenes and say, is that really as good as it sounds, right? I want to know the truth. What am I getting into? Is it really only 1 hour a month, or is it 1 hour plus 3 committees, right? And so I could ask those kinds of questions and feel more comfortable in it. Next slide. So really thinking about, it's important to think not only about policy and system design, but how are you going to sustain this? How are you going to sustain family voice in your agency? Are you going to change the bylaws so that you have families who are on your board of directors? In policy and system design, do you have to change other things? Do you need legislation? Is there legislation that gets in the way? Are there regulations that get in the way? What are your lawyers saying that keeps you from being able to do it? And what are the workarounds for that? And there may not be any. So I'm not taking that lightly, Jeff. But I think really thinking deeply about how can you engage families in a way, and maybe you engage them in groups of families. Maybe you reach out to groups of families to inform your work until a relationship has been developed, or until you can find a way to get them into your agency. So instituting those bylaws and targeted recruitment strategies based on whatever you're looking for, making sure that scope and authority and responsibility is very, very clear. If it is about it, if you're forming an advisory council, it's really clear to say what that is, right? Advice to whom? About what? And why? How is it going to be used? Because I think oftentimes families believe that the change will be made based on what they say. Right? And sometimes that's possible, but it's not always possible. And how do we recruit multiple families with diverse experience? We need that. We need all sorts of cross-system experience to inform the work of policy and system design. How do agencies work with one another? How do families who are being served by both child welfare and mental health, or need to be served by both, what's getting in the way of that? What's preventing that? Is it about a workforce shortage? Is it about, I don't know where to refer them? Is it about, I don't know how to help them access those services? So thinking at a systems level about how you can strengthen that work is really important. And it may come down to, for some systems, collaborative agreements, right? Collaborative agreements among what will we share with whom and what can we share? Okay, next slide.
There's always those last couple bullets that just,
Yep, I know. So I'm open to questions, but I'm thinking about the first section of slides that talked about outcomes. So what are some of the outcomes that you would like to improve? And you can feel free to put them in the chat box or shout them out. I don't hear a lot of shouting out today. Chat box.
I think they might be muted actually.
Are they? Oh, okay.
As part of the webinar.
Thank you.
And if you do have questions, you can put them in the chat or in the Q&A, either or, because I'm keeping an eye.
Thank you, Erin.
Communication between workers and families. Are there specific it feels like, and it's been a minute since I was doing direct practice, but it feels like sometimes families are an afterthought as opposed to like truly integrated into like a day-to-day practice.
Exactly.
That makes me think of communication.
Exactly. And I think when we talked about the outcomes and we talked about the functions that families could serve, I mean, I'm hoping that people are going to go back today and say, I remember those functions. Wait a minute, I wish we had one of those at our agency. That could take a load off from our workforce, right? Right? And so to think about that. So I'll be interested in learning back from you if you have hired families to do any of those functions in your organizations or in your agencies, whether they're state or local agencies, because I think it really will be a return on investment for you. And if we have less workforce stress, life is better for all of us. Right. If we have a workforce that's more available because other people are picking up a piece of it.
Mhm.
Improve quality of communication. That's interesting. We're getting communication from
Mhm.
3 people here. Any other thoughts? And can we go back to that? We probably can't, to those
We can.
outcomes. The
Yep.
outcomes slide. Let's go to the outcomes. I want you to look at those outcomes and think about them. Are there any that you wish? You know, better satisfaction with your services.
This one.
Yeah, there you go.
Yeah.
Are there any of those? Think about where you sit along that line. If you're an agency rep, if you're a family member, if you're a system person, are there any outcomes you're looking to improve? Because if not, I want you all in my state. We need help here. I'm going to let you think, and I'm going to let you think about this, and you will get these slides.
Yes.
So,
There will be a
anything?
follow-up email.
Yep, great. And any specific questions? I know that you're going to do some.
Looks like I had, let's check the Q&A here. So Robert says, in my experience, it seems like there's an adversarial role between the families and the agency. So again, trust and more of a collaboration role, but that's hard.
Ah,
Adversarial, yeah.
so that often comes, and I have to say family organizations are always sort of having to level that out,
Mm,
because often families have been disappointed, let
mhm,
down, right? Because we've been told the solution is this or that, and it hasn't worked. And so it's like a broken promise.
mm,
And broken promises leave us feeling kind of raw. And they make us extremely worried because we had all our hopes on that, perhaps to even save our children's lives.
mm.
And that's not being unrealistic. Often it is about saving our children's lives. And so we sometimes feel that we feel angry, we feel disappointed, we feel betrayed. And so getting past that is hard. And number one, because you showed up today, I know you are the people who can get past that, because it's about that relationship building and that trust building and acknowledging, just sometimes acknowledging, I bet this has been a hard journey, or tell me about your journey. What got you here? Not to ask what's wrong, right? What got you here today? And to have that kind of conversation that then probably let you know you might be feeling that way too if it was you. So really more advocacy for families in the medical field, community healthcare workers that serve as a bridge. Right?
Mm.
Great. Increased engagement from biological fathers and other male caregivers. Thank you for saying that. And
Yeah.
we're delighted you asked for that. So Fredla has brought a consultant to this team to do this work. And we will be doing a lot more work around engaging fathers and how to engage fathers and how to actually start fatherhood initiatives as well, if your community is looking for one. Thank you. Other things you want to share today? Things you're doing a great job at engaging families. Because I know you must be. Anybody got a strategy that you want to share? So I began by saying it's the hardest work you'll ever do. It's the most rewarding work you will ever do. So I want you to know that. Based on the outcomes, based on the fact that families rely on you. It is the most rewarding work you will ever do. So thank you.
Thank you, Pat. I'm gonna, I have a few closing slides. Stay with me. And I do want to make sure, folks, if you, before you log off, if you can, I'm going to put the link to our survey. It's a short survey, I promise. And we would love your feedback. We are doing monthly webinars, and I take every piece of feedback to heart in planning for future webinars. And so let me put, you can see, you can use the QR code, but I'll also put the link in the chat so you can just click it and complete this. We have found that people are more likely to complete the survey if you do it right while we're still here together. So thank you in advance for providing your feedback. Oh, I do see a hand raised. I don't know if I can unmute you. Let me see. If not, can you put your question in the chat? Oh, India, allow to talk. There we go. See it. India, can we hear you?
India's on mute. Is
There
that
we
by
go.
us or by India?
Let's see. I was trying to do it for you, India. If not, can you put your question or comment in the chat? Yeah, it does say mute. Yeah,
Oh, that's okay. Thank you.
these Zoom
Yeah.
webinars.
Yeah. Okay.
Okay, so just wrapping up, please do share your feedback with us on the survey. And then I wanted to just draw your attention to our National Center website, particularly our Knowledge Hub, which has over 400 resources on a variety of topics related to child welfare and mental health. There is a section about engaging families, and there's a lot of great information there. And if you're interested in learning more about the technical assistance or more about the National Center, feel free to contact our director, Mary, and you can see her email there. And lastly, to follow along with our continued work, we are working at the state level, but also at the national level, and provide some universal technical assistance, such as these webinars. If you want to stay connected with us, you can scan that QR code or click the link once you get the, the PowerPoint to sign up for our newsletter. And we send maybe 1 to 2 emails a month is all. So thank you all. One last plug to please complete the survey. And then when you're finished, feel free to go about your day. And thank you very much for joining us today. And thank you, Pat, for sharing your knowledge and expertise.
Thank you. Thank you all.